again. This is the second part of our series on an introduction to Islam and taking care of Muslim patients and interacting with Muslim colleagues. This morning we have Amina and Zach from the ING, the Islamic Network Group, that's been doing a great job and really instrumental in facilitating these sessions and generating some wonderful content that I think will be really informative to you. Amina Jandali is one of the content managers at ING and a founding member. She has a graduate degree in Near Eastern Studies from Berkeley, and Zach Marquith is ING's educational director. He has a PhD in Islamic Studies from the Graduate Theologic Union. And with that, I'll turn it over. I'll just an overview of how this morning is going to work. We're going to have some didactics from Amina and Zach, and then around 7 o'clock we're going to be breaking out into small groups where we'll work through a couple of cases that I think will be really helpful in kind of bringing some of this the content that you're hearing into a little bit more of a real life scenario. Each group will have a couple of facilitators that will take notes, and we'll report out at about 7:15 and have about 12 to 15 minutes to discuss. And with that, I'll turn it over. Go ahead, Amina.
So my colleague Zach is actually going to start us off. And
thank you so much for the kind introduction, Dr. Morshid, Dr. Zimmel. Good morning. It's a pleasure to be here. Today's presentation is titled Healthcare for the Muslim Patient. And if I can ask Hawa to please share the presentation. Before getting into the presentation, I'll briefly discuss key issues to keep in mind about enhancing cultural competency for the Muslim patient. If you look in and click on the link in the chat, you can view our handout on a guide to interacting with Muslim patients. Next slide. And next slide, please. The handout and presentation focus on 4 key issues. The first, culture, including language and communication, family and decision-making. Then modesty, including distinctive attire, privacy, and gender interaction. Followed by diet, including dietary restrictions on alcohol and pork, including in medicines and medications that contain these, as well as meat requirements. And finally, ritual practices, including ablution, daily prayer, and fasting. Next slide. There are many benefits of cultural competency, which I'm sure you're aware of. They include respect for diversity among staff and patients, a defined set of values and policies that facilitate cross-cultural service, better patient-provider rapport, increased patient satisfaction, improved quality of care and health outcomes, and reduced healthcare costs, which is the bottom line for hospitals and other healthcare providers. Next slide. Understanding of culture and practices, which are often impacted by religion, enhances interaction with Muslim patients. Knowledge of specific issues help prevent misunderstandings and lead to better rapport and health outcomes. Next slide. Here you see our outline. We're going to begin with religious perspectives on healthcare, and then discuss some cultural factors that impact healthcare, followed by specific orthopedic considerations and end-of-life considerations. And then we'll close with the case studies led by Drs. Morshid, El Naga, and Diab. Next slide. We'll now look at Islamic perspectives on both healthcare and illness that may impact healthcare for Muslim patients, keeping in mind that Muslims have a spectrum of views as in any faith. Next slide. The following are Islamic values that relate to healthcare. An important principle applicable to the field of healthcare is the tenet that necessity overrides prohibition. This means that in an emergency situation or under dire necessity, items or actions which are normally prohibited, such as the consumption of pork or alcohol in medicines or medications, become permissible if no alternatives are available. Also, the removal of harm is enjoined, but one should not do greater harm to prevent lesser harm. When faced with two choices, preference should be given to the lesser harm. Islam also emphasizes the sanctity of human life and the obligation to protect it, as emphasized by Quranic verses such as, saving a single soul is like saving all of humanity. One of the highest goals in Islamic law is to preserve human life. Next slide. Muslims view illness as a test from God, as well as part of God's divine plan. Acceptance of God's will is viewed as a rewarded act. Therefore, sickness is viewed by some Muslims as a source of purification from sins. However, acceptance of sickness does not mean giving up. There is a prophetic saying or hadith that every disease has a cure, meaning it's important to seek medical treatment. Visiting the sick is highly encouraged as an act of compassion.
Amina?
The person in the hospital. Number of visitors, not limited to close friends and family. This is particularly the case if the patient is not well known in his or her local community. Next slide. We'll now turn to some cultural factors that may impact healthcare for the Muslim patient. Next slide. The first thing one encounters is a patient's name. Many Muslim names are Arabic. The best way to learn the correct pronunciation of a name is to ask the person to pronounce it. Common names for men include Muhammad, likely the most common name in the world, as well as Ali, Yusuf, and other names of prophets, and a series of names that begin with Abd, such as Abdullah. Common names for women include Maryam or Mary, a biblical name, Fatima, Aisha, and Sarah, another biblical name. Spellings may vary for the same name or person. For example, the name Muhammad is spelled in a variety of ways. Arabic last names often include al or el, meaning the, with or without a hyphen. This prefix is sometimes dropped for convenience. Which result in variations of the same name. Many Muslim women, especially Arab women, keep their maiden names after marriage, a practice which is becoming more popular in the West. This means that mothers may not have the same last name as their children. Next slide. One of the best ways to break the ice is with the Arabic greeting, Assalamu alaikum, peace be upon you, which, as previously mentioned, is the traditional Islamic greeting throughout the world, similar to the Hebrew shalom, which has the same meaning. The entire phrase in Hebrew is shalom alaikum. While most Muslim Americans are fluent in English, recent immigrants may have a poor command of the language. Even if they are educated, they may be fluent with technical rather than conversational English. In addition, some immigrants may be hard to understand due to a heavy accent. Women's knowledge of English may be more limited, particularly if they are recent immigrants. Use formal titles when you meet people, such as Mr. or Mrs., ma'am or sir. Avoid the use of colloquialisms or acronyms since people may not be familiar with or understand them. Exercise patience with accents. Speaking slowly and clearly, not loudly, is the best aid to being understood. And try not to assume that body language has the same meaning around the world. A nod may not necessarily mean I agree. Next slide. Immigrant families often have extended family systems with strong family ties and well-established family roles. Elderly patients traditionally live with their adult children and are afforded great care and respect. However, today, with changing norms and roles, as women struggle to balance work, children, and elder care, they're less likely to expect the same treatment from their children, and the new generation is less likely to live with or care for their parents. Next slide. Medical decision-making typically involves the patient's immediate family and even extended family, even when the patient is conscious and competent. Decision-making capacity can be multi-generational and can be influenced by a variety of factors, including age, education, and length of residency in the US. In some cases, only the spouse participates, while in others, the spouse and grown children are involved, or only the grown children if the spouse is not capable. The oldest male member may be assumed to be the one to wield the most influence, but if he's a recent immigrant or less educated than his younger sister, for example, this may not be the case. Recent immigrants, especially elderly patients, may prefer to have their adult children make decisions and may assign power of attorney to them. Advanced directives are allowed and actually recommended as long as they do not violate Islamic rules and injunctions. However, since there is generally a reticence to discuss such issues, the topic of advanced directives is not commonly broached with elderly patients, and so they may not be in place. Some immigrants, especially women, who may not understand the system or may have limited English, may also want and even expect their husbands to oversee their health care and even make medical decisions, a role which the women may feel is appropriate for him as her protector. Next slide. Muslim men often grow beards in adherence to prophetic tradition. Some Muslim men trim their beards while others grow their beard out based on varying interpretations of this tradition. Muslim men may also wear a skull cap similar to the yarmulke or other ethnic clothing, especially when praying or going to the mosque. Turbans are not commonly worn by Muslims, despite the perception that they are a Muslim dress. Men who wear turbans are generally Sikhs. The Muslim turban should not be confused with the Sikh turban, which is larger and comes to a point in the front with a larger bun shaped in the back. Muslim turbans are usually white and rounded. Traditional clothing for Muslim men is modest and all covering. And while you rarely see Muslim men in public in ethnic clothing, they often wear it when attending the mosque or at home. I'll now turn the presentation over to my colleague, Amina Jandali. Thank you so much for your time.
Thank you, Zach. So now we're going to look at distinctive attire for women, which you'll see from the picture that Muslim women dress in a variety of ways. Some Muslim women dress modestly without covering their hair. Others dress modestly and cover their hair. So one can't necessarily assume that a woman who wears a headscarf is more religious than one who doesn't. As part of the modest dress that Muslim women are encouraged to wear is what is known as hijab, which refers not only to the headscarf, but also to the entire outfit, which includes covering the head, arms, and legs. And it's very similar to what is worn by Orthodox Jewish women or by traditional nuns. And you will see a great variation in hijab styles, from very fashionable jeans, maybe, and a long sleeve shirt, which is worn by younger women, to maybe pants and a top, or a loose skirt, or a long dress, to more conservative, maybe all enveloping outer garments, all worn with the headscarf. And the hijab or headscarf is worn before non-related men or in public, and it's for both modesty and identification purposes. And it begins around puberty, but you will see some girls wearing it even before that, maybe because their mother wears it, or maybe because their parents really want to encourage it. You will also see a smaller percentage of Muslim women who also cover their face in what is called the niqab, which is a half veil. And both of these can be worn for both religious and cultural purposes. Again, women do not wear hijab at home or in front of other women, male relatives like their husband or their father or their son. So a woman who wears either hijab or niqab may feel that her privacy has really been violated if she's asked to take it off in front of a man who is not her relative, or if she's, wearing a traditional hospital gown and it's really recommended if it doesn't interfere with procedures that she may be allowed to wear her own clothing, obviously not on the operating table. Next slide. So for many Muslims, male and female, but particularly for women who wear hijab, they're going to want to have a private room so that they can take off their hijab, feel at home. And it's also greatly appreciated if a male healthcare provider knocks before entering the room so that she would have a chance to put on the hijab or other clothing. And for both genders, private parts do include between the navel and the knee, which some Muslims believe should only be exposed before their spouse. And so they may be uncomfortable even in front of same gender care providers exposing that part. So even if they're being examined in other parts of the body, they may want to keep those parts covered or covered as soon as they're no longer being examined, especially obviously in the presence of the opposite gender. Additionally, some patients may feel uncomfortable using the bathroom or showering in the presence of others, even same gender, and may request a shower behind a barrier or maybe in their clothes or underwear. Next slide. So some additional gender issues include the preference for same gender care, as we've talked about, especially for more intimate care, which would be x-rays or physical therapy. However, medical care by the opposite gender is permitted. We talked about the emergency situations where this would be overruled by the principle of necessity overriding prohibition. However, some Muslims may not be aware of this principle and may continue to kind of insist on a same gender provider, and you need to just let them know politely that this is not available if it is not the case. And some Muslims may also be uncomfortable with any kind of social touching of the other gender. That would include patting or hugging, which during COVID, we're not doing a lot of that. It might even be refraining from a handshake. And so what's important here is not interpreting this as a personal affront, but merely that they are adhering to their faith. Additionally, some Muslims of both genders may avoid prolonged eye contact with the opposite gender, and this would be out of modesty and respect. And some patients may be uncomfortable being alone with caregivers of the opposite gender or even with the same gender, and they want their spouse or a friend in the room with them during treatment. Going on to dietary restrictions, there are two major dietary restrictions for Muslims, as Zach had mentioned: no alcohol and no pork, and that would also include no pork byproducts, which would be like lard or in the past, a lot of other things. Today, it's mainly around gelatin. You'll also find that many Muslims only eat meat that has been slaughtered in a certain way, known as halal or zabiha, and this is similar to kosher in Judaism. So let's look at each of these individually, beginning with alcohol. So ethyl alcohol, also known as ethanol, is what is forbidden for Muslims, and these are found in some medications or medicines such as cough syrup or mouthwash. And so these would be avoided by Muslims, but there are generally alternatives to these. Other types of alcohols that are not intoxicants are not allowed, like benzyl alcohol, glycerol, but most Muslims really don't know the difference. Next slide. In terms of pork and pork byproducts, like I said, that would include lard as well as gelatin. They're often mixed with bovine, but sometimes they don't specify. So some medicines include gel caps or capsules, and so people who are knowledgeable about this may request caplets or tablets as an alternative if they're available, if they're not, just informing the patient that there is no alternative. And then more specific issues like heparin, maybe porcine, which I'm not going to go into. Vaccines also may contain gelatin that's porcine. Again, most scholars say that that's fine because it's become lawful, both due to necessity as well as transformation. And then for porcine grafts, obviously, would be a case of necessity if there is no alternative. Next slide. Additionally, some Muslims do not, or most Muslims actually do not eat rare meat because the consumption of blood is prohibited. And then some Muslims, as I mentioned, eat what is called halal meat. And so for someone who only eats halal meat, they're going to want to eat a kosher or seafood or vegetarian diet. Additionally, some Muslims do prefer to eat home-cooked meals, and this is both for religious or cultural reasons or just because they're accustomed to it or actually tastes really good. Next slide. So the term cleanliness, in Arabic, there's a term tahara, which means purity in two ways, both physical purity, meaning removing any kind of unclean substances from the body, as well as spiritual purity, meaning purifying the mind and the soul. And so some Muslims try to maintain a state of tahara, and may be very careful about avoiding contact with substances that are considered unclean, such as feces or urine, blood, or vomit, or cleaning themselves immediately after any contact with those substances. And that's why Muslims generally clean themselves with water in addition to toilet paper after visiting the bathroom. Usually in the hospital, a cup or a peri bottle serves that purpose. Next slide. So another meaning of the word tahara means maintaining a state of cleanliness through what is called ablution or wudu in Arabic, which is ritual washing that is required before performing the ritual prayers. It obviously does contain an element of physical cleanliness, but is also spiritual, which is also considered very important, especially by elderly parents who may pride themselves on always being ritually clean. And it basically includes washing one's hands, one's mouth, one's nose, one's face, wiping the hair, and washing one's arms up to the elbows and then feet up to the ankles. So for a Muslim patient who is immobile, they may request that water be brought to their bedside or may need assistance performing ablution, especially elderly parents for the feet. And this is repeated before performing one of the 5 daily prayers if one has engaged in any of the actions like urinating, defecating, or losing consciousness, sleeping, or profuse bleeding. If a patient's wounds or sicknesses are such that water would be detrimental to their health, they may also instead perform a symbolic dry wash using a stone or some sand where they would just pat their hands on it, rub them together, and then a second time rub it over their face. So that would be purely symbolic. And then, of course, certain situations require a shower, such as post-intercourse, post-menstruation, or postpartum. Going on to the daily prayers, next slide. As previously mentioned, practicing Muslims pray 5 times a day, kind of following the movement of the sun. So before the sun rises, around noon, in the afternoon, after the sun sets, and then again at night. And each of these time periods is a 2 to 4 hour interval in which they can perform the prayers. And so as the days get shorter and we're now moving into winter, and on Sunday, the time changes, so the day becomes a lot shorter, but it'll still be about a 2 hour time period. So the prayer can really be performed in any quiet, clean place. So a patient's room is perfect. A patient could use a clean towel or a sheet, or they may want to bring their own prayer rug. A bedridden patient may need to pray either sitting or lying down. And the prayer is performed facing towards Mecca, which for American Muslims is generally facing northeast. A person praying should really avoid facing a statue or a picture or another person. And so while privacy is not required for the prayer, it is desirable for concentration that, there is some privacy, and also for female patients for reasons of modesty because of the physical nature of the prayer. Going to the next slide, the prayer actually does involve different positions, including standing, bowing, prostrating, and sitting. And during those movements, worshipers will recite from different Quranic verses as well as other supplications. So a sick patient, as I mentioned, can pray sitting down, or if unable to even stand, they could pray lying down. The prayer lasts about 5 to 10 minutes, depending on how many verses a person reads or how quickly they read. And since the patient cannot talk or respond during the prayer, it's really recommended that someone come back after the patient has finished praying. Next slide. In terms of religious objects, we talked about the prayer rug. They may want to keep that in the room with them, and it again should not come in contact with any impure substances such as blood or urine, or touch with someone who might have come into contact with those substances. Another important religious object for Muslims is the Quran, which is the Muslim holy book and is considered to be divinely revealed. So it should also be treated with respect, shouldn't be taken in the bathroom, put on the floor, or touched with hands that have come into contact with any of these substances. Other items might be prayer beads, similar to rosaries, which are used to recite the names of God. Additionally, some Muslims wear an amulet or necklace with Quranic verses or God's name, and so all of those items should not be taken in the bathroom or disrespected. Next slide. The month of Ramadan is a lunar month, and so it moves 11 days earlier each year. And in Ramadan, Muslims fast, which is an abstention from food or drink during the sunlight hours. And it's recommended before the fast to have a pre-dawn meal similar to breakfast, and then begin the fast, and the fast ends at sunset with a light fast-breaking snack called iftar, which is usually dates or water followed by dinner. Next slide. So there are a number of categories of people who are exempt from fasting, and those include pregnant or nursing mothers, menstruating or postpartum women. Prepubescent children are not required to fast, but often do so if the rest of the family is doing it. Travelers can also not fast due to the hardship and make it up later. And then elderly and sick people are exempt from fasting, especially if they need to take medicine during the hours of fasting. Sick patients obviously are not required to fast, but may insist on fasting anyway, particularly if their illness doesn't affect their ability to fast. If it is not suitable for the patient, of course, it's useful to have their children or relatives or a religious leader help convince them not to. Next slide. But if fasting patients really want to fast and it's not something that's going to impact their condition, then effort should really be made to accommodate them. So for instance, many diabetic Muslims want to fast during Ramadan, and that should obviously be made under the guidance of their physician, and it should take into account, whether they can do it safely, what they need to do to change their diet and to monitor their glucose. And so there needs to be ongoing communication between the patient and physician. They're also going to need special arrangements both for their meals as well as for medications. Next slide. Yeah.
I just wanted to let you know that you have to end literally in 3 minutes.
All right. So in terms of medications and fasting, what breaks the fast are oral medications or any mouthwash or any injections or IV fluids that are for hydration or nutrition. And then eye drops, blood tests, other things which are solely medicinal do not break the fast. And then there's a difference of opinion about things like inhalers, nose drops, or eardrops. Next slide. So in terms of scheduling medications in Ramadan, obviously seriously ill patients should not fast. And if it's an emergency, they need to break the fast. But for other medications, it should go to a twice a day where they can take it before the fast and after the fast. And same thing with insulin. And then moving on to some brief orthopedic considerations. Obviously, next slide. The loss of a limb for anyone is going to be very challenging. For Muslims, there's an emphasis on dignified treatment of the body and body parts. There's also trauma around that, which might lead to anger and depression, although Muslims do take comfort in believing that everything is God's plan. Next slide. So there may be mental health needs that come into play, and there are a growing number of organizations that offer specifically to Muslims. One of them is in the Bay Area. It's called maristan.org. Another one is based in Chicago and Los Angeles, and it's called Khalil Center. Both of them are now virtual. And then lastly, going into end-of-life considerations, which is just more like an FYI. Next slide. Some of the Islamic views of death and dying include the belief as Muslims in an afterlife as the final destination, as well as the belief that everything is part of one's divine plan, it's God's divine plan. However, death is always a test of faith for family and friends, and sometimes that leads to a little bit of denial if there's a terminal illness. Next slide. And so despite these beliefs, you will find sometimes reticence to inform a patient of terminal illness, although Islam does really encourage knowing about terminal illness to prepare for the transition. Islamic teachings also really emphasize caring for the elderly, and particularly elderly parents, and so placing them in a nursing home or any kind of long-term care may result in a lot of guilt and a lot of grief for both sides. However, explaining that that's the best option is the best. And then lastly, if you have a nursing home patient, there's going to be a lot of visitors, a lot of interactions, including helping with feeding and other tasks. And then assisted suicide and euthanasia are strictly forbidden because of that prohibition against suicide in Islam. So that is a very brief overview of some general rules for interacting with Muslim patients. And now you're going to have an opportunity to really put into practice what you've learned. Your colleagues have come up with these great scenarios, and your task is going to be to apply what you've learned and how you will deal with each case based on your knowledge of Muslims. So some of the issues that Zach had mentioned at the beginning to keep in mind, next slide, again, include culture, modesty, diet, and ritual practice. And I'm going to just quickly highlight the cases. They're going to be in your chat. The first one is
we're going to go ahead and stop here.
Great.
All of the cases have been put in the chat. Melissa, you can go ahead and break people up into different groups, and each of the groups will have we'll have a chance to review these cases.